I'm not sure. I think it's a valid question, though. I know a number of years ago, when I first got into the healthcare industry at our local hospital, Hens Community, there was a unit there, I think it was called CSR, and it was a sterilizing type unit. They took the trays and I think, the hardware, I'll call the knives, et cetera, for cutting and doing certain procedures, and those were sterilized in machines, and perhaps that worked well, and perhaps you can sterilize certain equipment. I'm not sure, but they did it for a number of years, and I would tend to believe that it probably worked quite well. But this seems to be something a little different. This seems to be catheters and things like that are made for single use. They're noted single-use equipment. Much like the oxygen mask, it's a single-use piece of equipment. How could we possibly take something that is a single-use piece and use it on another human being? I'm not sure. Is there some kind of security in all of that? Maybe there is. I'm hesitant to think that they're going to use it on me if I'm going in there, and I do hope that there's a choice for me if I'm going in there. And as I said, I can't really, there are a number of cases, and I have some statistics here that I want to look at. What about the transferring, the cross-contamination? We concern ourselves today, H1N1 was a great big thing, and now it's a level 6 or whatever it is across the world, but yet the common flu takes more lives in the run of a year in Canada than anything like this. They recommend good hand washing, et cetera, and so on, and sterile procedures like that. Appears to be a safe method. Obviously, somebody has studied it. We listen to the experts in the Department of Health, who I believe are very wise. The doctors, Watson Creed, we've had before us, and I've met outside of this type of legislature and so on, in other forums, all very knowledgeable. Seems, that it's less of a deal, and I don't want to, think that it's any less of an issue, but they play it down as less of a deal when it comes to the common cold and the flu. Well, that's fine. But again, you're washing your hands and you're doing your thing. You're not stabbing people with catheters and needles and reuse of equipment. That's concerning to a lot of people. I know I've already got a couple of calls on this, people thinking, with my history, I think, in my previous work life, what do you think of this stuff? And I'm going, well, there's a lot we don't know yet. But we're certainly going to be very interested to find out. But this cross-contamination and infection spreads rapidly through fluids, bloods, and so on. And it's going to be interesting to figure out, when we look at this, it appears to me to be, it's all about the money. Well, I do hope that the new government is not thinking, well, let's save a few dollars here and a few dollars here and a few dollars here. What's a little bit of, re-sterilized, reusable equipment? What's it worth? Is $150,000? When I look at my example, an ultrasound catheter is $5,000, number of years 60, cost $300,000. They're saying the reprocessing fee somewhere in the vicinity of $100,500, so about 50% of the price. Where's the break? Is $150,000 worth one life? Are we going to up our liability insurance just because we think, oh, well, we might get sued over an issue? Well, I think, we're open to being sued any day in a hospital. Procedures and things go on. Thankfully, we're not, I don't think, sued a whole lot. I think that our doctors and our nurses and our healthcare professionals are indeed that, professional, and do a wonderful job looking after each and every one of us. But it opens the door. This is going down a road of great concern. And, we see cases in the U.S., questions are being raised about integrity of what it is we're doing, the ethics of professionals and doctors and so on, administrators that are authorizing this sort of thing. And again, I don't think that unless we have some more information on this, it's going to be a difficult thing to swallow, I guess, for lack of a better word. And I know there are catheters out there like that are used for the swallowing device, so no pun intended. But we really have to be cognizant of the fact that those that are already ill and going into a hospital, those that have certain problems already, medical issues that are open and acceptable to the slightest thing, are they at risk? Is there a risk? Perhaps there is. Perhaps there isn't. But we don't know. It's, you can read what you want in the paper. I'm not one that says I believe everything the paper, the media prints. I'm not. I don't go with that. But I'm looking for the facts on it, and I'm hoping that the minister will enlighten us, or somebody's going to enlighten us on what the Department of Health is doing with it. And I look forward to hearing her comments. I'm wondering You know, I talked about the insurance being raised. What about the legalities? You know, are we hiring a lawyer to assess the situation? Has it already been done? What's the cost of doing that? Where's the real savings at, or is there a savings? I know in healthcare the budget's phenomenal. I appreciate it very much. But at the same time, we can't be cutting corners a little bit here, a little bit there over, you know, putting patients' lives in jeopardy. So I look forward to hearing others' comments on this debate, Mr. Speaker, and with that, I'll take my seat.
Thank you. Chair now recognizes the Honourable Minister of Health.
Thank you very much, Mr. Speaker. Mr. Speaker, I'm really pleased to have an opportunity this evening to stand in my place and speak to the issue that's been brought forward by the Conservative Party. And I agree with the honourable member in terms of the concerns he's expressed about patient safety and the need to proceed carefully and to have a full airing of this issue and public discussion and a lot of transparency and information. I think those are all very valid concerns, Mr. Speaker, and I recognize that his profession as a paramedic for many years informs a lot of his views and the things that he has said here this evening. Mr. Speaker, the topic has come about here this evening, I believe, as the result of Capital Health issuing a request for proposals for the reprocessing of single-use medical devices by providers who are accredited by the Food and Drug Administration in the United States. Capital Health has not committed to pursuing this plan, but are in fact investigating this possibility. By issuing the tender, Capital Health will gather information about the types of items reprocessors are prepared to handle, their methods of sterilization and remanufacturing, and the potential cost savings. Capital Health has consulted with staff in the Department of Health, and the information gathered through the RFP process will be shared with the department. This is not new, Mr. Speaker. Reprocessing has been happening in the United States for many years, but until recently there were no providers that had undergone that sort of rigorous certification that would reassure us of the quality and safety of this process. Mr. Speaker, in January of 2009, the Capital District Health Authority asked about the Department of Health's policy on third-party reprocessing. Nova Scotia and other provinces and territories have worked with Health Canada to develop guidelines on third-party reprocessing. The national position has not been finalized, and in its absence, Health Canada's guidance on single-use devices has been adopted. And this is a guideline that's been around for a while, Mr. Speaker. Reusing items within the guidelines has been established as best practice or good practice. Above all, Mr. Speaker, it allows us to deliver healthcare safety without compromising the already delicate health of hospital patients. It also reduces medical waste, which not only takes up space in landfills, but can also be biohazardous, so it must be disposed of very carefully. And, Mr. Speaker, it is true, it also means that there are some cost savings. Disposing of medical waste is expensive, so is replacing supplies that could be cleaned and reused under appropriate guidelines. Reusing medical devices, Mr. Speaker, therefore, is something that's worthy of exploration. It isn't an invention of the Nova Scotia Department of Health and Capital District Health Authority. Reusing medical devices is well researched and accepted and is practiced with strict parameters and is done in many jurisdictions across this country. In fact, a previous Minister of Health was at the table where the Pan-Canadian position statement on the reuse of single-use medical devices and third-party reprocessing was being developed. Capital Health is Nova Scotia's largest acute care provider, and as such, they do a high volume of surgeries each year, Mr. Speaker. And as we move more to the use of minimally invasive surgical techniques like laparoscopic surgery, which are shown to improve patient outcomes, we find we use more and more single-use items and face greater increased costs per case and the environmental issues that occur as well. The Department of Health takes patient safety very seriously, Mr. Speaker, as does this government, as does the Capital District Health Authority. And I'm confident that any changes in practice made by the district health authorities are always reviewed to ensure they are meeting the highest level of safety based on the facts, based on available science, the research, and best practices from across the country and indeed internationally, Mr. Speaker. Nova Scotia has a strong public health system, and we are committed to maintaining and improving it. We support our district health authorities who provide excellent care to patients, care we trust at the Department of Health, and care all Nova Scotians can trust. They are professional of the highest order, committed to informed practice in all aspects of health care and patient care. And we in the district health authorities, like our counterparts across the country, are working to ensure that current resources are being used as effectively and efficiently as possible. Healthcare is a large and growing portion of the budget of every province and territory in the country, and reusing medical devices safely and by following informed practice and agreed upon guidelines is a small way of reducing costs without affecting patient care. Now, Mr. Speaker, we will, of course, stay in touch with Capital Health and with all DHAs around this adventure. We have good working relations with them, and we'll endeavor to support them as we go forward and ensure that the policy guidelines of Health Canada are met. And, Mr. Speaker, I just want to be absolutely clear, because the member, I think, rightly asked about certain elements of the scrutiny that will be brought to bear. As always, we have asked the District Health Authority to demonstrate the safety, the legal and ethical issues that are associated with this practice, as well as the budget implications. And I want to emphasize that our focus is not on the fiscal elements here. Our focus is on patient safety and the legal and the ethical issues. And regardless of the budget implications, if those stringent requirements are not met, then this would not be a practice that we would favor. Patient safety has to come first, Mr. Speaker, and I can assure all members of this House that Health Canada guidelines will be the parameters and the lens through which any project of this sort will occur. Thank you, Mr. Speaker.
Thank you. Chair now recognizes the honourable member from Halifax, Clayton Park.
Thank you very much, Mr. Speaker. And it's my pleasure to rise this evening and speak in this late debate on the resolution that's before us. The resolution was submitted by the third-party caucus, the Tory caucus, and in it, it has two parts to it. It actually asks that the health minister immediately review the file, and we're talking here about the reprocessing of some medical equipment and devices. And again, that's a word I wasn't familiar with, Mr. Speaker. Reprocessing simply meaning sterilizing and repackaging and making sure that the equipment is safe for reuse. That's really what it is. So we have to look at sometimes at the language that is used. But it asks the minister to look at that that, and then it also jumps to the conclusion that the minister should put an end to the practice right away. Just put an end to it, because it might be, it suggests here, detrimental to the health of Nova Scotians. And Mr. Speaker, as I mentioned to you, even as the health critic, I was not aware of this practice, so I've done a little research, as I'm sure the other members of the House that had to speak tonight did. And I find that, first of all, the Conservative caucus is gone a little bit overboard here, because this is simply an RFP. It's an opportunity to investigate whether or not this is a safe practice, to learn more, for Capital Health to learn more about whether or not this would indeed be a way to save some money. And although it is not driven solely by fiscal, I guess, realities, it is something that's important. We know, we've said here this evening, the Department of Health absorbs almost half of our budget, and we'll be looking at that more closely in the estimates next week. But it's a growing part of our budget. In the last number of years, it's grown 7% and 8% a year, and it will overwhelm our entire provincial budget if we don't look at ways to be more efficient and effective. This is one of those possible ways. And in terms of being alarmed about whether or not there's any patient safety, I was actually quite happy to see that other places have already done some of the testing that we would want to do. This practice is now in place at Toronto General Hospital, McGill University Hospital, and at a hospital in Vancouver. And that is one of the companies that is FDA approved, that has met the standards of training and care, that could do this work for us, is actually active in those 3 hospitals in major cities in Canada, doing exactly that, reprocessing some of the equipment that is, packaged and originally sold as single use. But Mr. Speaker, I think there is a tremendous amount of waste in throwing everything out in the hospitals. I know I've spoken to a number of other members today and saying that this may have been a few years ago, but my father was a pathologist, worked in a number of different provinces in Canada in provincial labs, and I know as a child visiting him, they re-sterilized everything. Everything was reused at the time. And now I understand we've had other diseases that have come up, like AIDS and other things that made people very nervous about the chance of reinfection. But I do believe that there are very safe ways to re-sterilize and reuse equipment. And I think we went from reusing everything to reusing nothing. And if you go into hospitals, I think there is a tremendous amount of waste. And it would be a good thing to look at being able to reuse some of the material, some of the different medical devices that are being used on a routine basis. It was mentioned, I think, by the health minister that the surgeries have become less invasive, and in doing that, we use more other kind of catheters and other equipment that they weren't using when they did the more old-fashioned surgeries. And in so doing, that's driven the cost up, actually, of surgery, while it's given a lot better health outcomes to the patients. We'd much rather have, a less invasive surgery to remove a gallbladder or something than the old-fashioned way, but there is a greater cost to the system. So again, I had the opportunity last year, when I was not the health critic, but was the finance critic, of stepping in and attending a press conference that Capital Health held, and that was in December, when in fact their projection for the year was that they would be in deficit, and they couldn't be there. And as a result, they were looking at saving everything from Kleenex to toilet paper to, everything. They were looking at how they could cut costs, and it was just a few $1,000s here and $2,000 there. It was that small. On a big scale, in the same press conference, they closed surgeries. They extended the March break period, closing down a number of the surgery rooms so that they wouldn't be operating as much. And there's a huge cost to doing that as well, Mr. Speaker, in terms of obviously the impact on patients who are on waiting lists and having to wait even longer, on the fact that we pay a lot of our doctors now not on a per operation basis, but on a flat salary basis, and therefore you have highly skilled surgeons who would be waiting until those operating rooms are open again, and that's not an efficient way to run our system. So, the hospital and the Capital Health District found itself under a lot of pressure, and I think that this shows that they're looking and keeping their eye on what other jurisdictions are doing, how practices in hospitals are changing, and as I said a few moments ago, hospitals had gone from a point of time when everything was reused and sterilized to the exact opposite. practices change. And I think that we have to put our confidence in the professionals that are running our hospitals and in the doctors and medical staff who would never be involved in a practice that is going to compromise health. And again, I say that as somebody who just, knowing that the doctors that I know and the medical people I know in the system, they will give this close scrutiny. If this is to go forward, it will have, I am confident, the closest scrutiny of everybody working in the hospital, and their confidence would have to be 100% before it goes forward. The first part of the resolution we're talking about, which says that yes, the health minister should be on top of the file, absolutely, I agree with that. And bringing it to the floor of the House today allows the health minister to if she had not been aware of it in the grand scheme of so many things happening in the health department, she certainly is on top of it today. And I think it is something that requires close scrutiny, and no decision should be made once the RFP is closed until the health minister has also had a chance to talk to all of the experts within the system. But I have as I say, a lot of respect for the people who are administering our health system, including the Capital Health District, because they're under tremendous pressure to ensure they give a high standard of care and maintain the safety and highest level of practice for all the citizens here in the Capital Health District, and again around the province. The minister is responsible for that same level. If this practice is successful in other major hospitals in Canada, I think we should be looking at it. I think that's only prudent and really fiscally responsible. And I don't think we should be automatically thinking the sky is falling because practices are changing in our hospitals. We have to be open-minded. And I think in the few minutes I have left, Mr. Speaker, maybe you tell me how many minutes I have. Oh, very good. In those few minutes, I think it's important to mention that the former health minister herself, who brought this resolution to the floor of the House, was actually the health minister, I believe, at the time that this was first looked at in January, February 2009, was when the Capital Health District first began to discuss this. And they didn't do it in isolation. They brought it to the Department of Health. There was everyone that needed to know at the Department of Health was aware of that trend and that they were going to investigate it. And it seems a little bit hypocritical, if I could say that, Mr. Speaker, that it would come to the floor of the House today as if the sky were falling and something very dangerous is about to happen, when in fact it isn't, and when in fact the very person who brought it to the floor of the House was fully aware of it months ago and had no objection. So, and at a time when she would have been in a position to say, to stop it if she actually did think there was something wrong with it. I think it's also worth mentioning at the same time that New Brunswick has just done an RFP for the same thing. That's a request for proposals. They're calling for experts in this field to come forward with their proposal on how they might help in the New Brunswick system as well. So this is clearly in place in other hospitals and a trend across Canada. I don't believe that any of our doctors or CEOs of health organizations would ever even entertain it if there was a danger to us. I think what is important here is the financial stress that the Capital Health District and others are under. I think there is also a call here to ask the minister, while they're investigating this, that they also get going on the business plans which are not yet accepted. The former government allowed years to go by with no business plans fully approved for the health districts. And this is part and parcel of it, the financial pressures that are on our health districts. But in this instance, Mr. Speaker, I think this is just an issue that needs to have the minister keep her finger on the pulse and watch it and confer with the health professionals. I do not believe that the health of Nova Scotians is in danger. Thank you.
Thank you. I want to thank all the honourable members for having taken part in tonight's late debate. The motion for adjournment was made earlier. The House stands adjourned until 10 a.m. tomorrow morning. Thank you.